My name is Dr. Lloyd Johnson. I'm an orthopedic surgeon here at Alabama Bone and Joint in Pelham, Alabama. I have a subspecialty in hip and knee replacement. When somebody comes in to see us with pain in their hip and their knee, the biggest thing we try to look for is what is causing the pain and what can we do to try to get it better. When somebody comes in with pain in the hip, we always have to wonder, is the pain coming from their back? Is it coming from their hip joint? And usually we can tell that by a combination of physical exam, asking you where you hurt, looking at x-rays, and sometimes we might need to get an MRI scan or some advanced imaging. A lot of times when we're doing our workup, we have to start with some conservative treatment measures because most of the times we can get people better without even getting to the point where we need to do surgery. For instance, if somebody comes in with pain in the front of their hip, we would examine them. We would try to see if moving their hip around causes reproduction of their symptoms. We would get an x-ray. If somebody has arthritis in their hip, there's a lot of conservative things we can do. It might start with some anti-inflammatories or therapy. Sometimes we can do some injections either in the office or even at the procedure center. Ultimately, if somebody has tried everything conservative and continues to have pain and discomfort, then we would talk about doing a hip replacement. One of the most important things about surgery, getting somebody ready for surgery, is making sure the patient is optimized for a surgical procedure. A lot of times that involves us working with your primary care physician, or if you have a cardiologist, working with your cardiologist. We need to go through what medications you might be taking. For instance, you might be on a blood thinner that we would need to know about. Doing a hip or knee replacement is a very reproducible operation. The way to improve the results is to get the patient as ready as they can be before they go into the surgical procedure. But at times we'll work on things like getting diabetes under good control. Sometimes we work weight loss and exercise type programs to get the muscles ready. Sometimes we set people up with some therapy so they'll have good balance and strength going into the procedure. We're thinking about a hip replacement. What happens on the day of the surgery? So first we've got to get ready for that day. Usually send you to the pre-op clinic a couple weeks before surgery. They'll have you meet one of the anesthesia doctors, and then they'll work on doing some blood work, and they might check an EKG to make sure that you're ready. Then on the day of surgery, you'll come in, you'll meet the anesthesia doctor, you'll meet me and my physician's assistant. We always mark the site we're going to operate on, so we're all in agreement about what procedure we're going to do. Bring you back into the OR, and they give you some sedation before we do an anesthetic. There's several different types of anesthesia they can do for hip replacement. You can do a general anesthetic where you're put all the way to sleep, or sometimes they'll do a spinal. Now, when they do a spinal, it's not like you're awake for the procedure. They still give you medicine so you think that you're asleep for the procedure. When we get somebody ready for a hip replacement, what happens? Well, we'll see you in the office. We will examine you. We'll look at x-rays. We'll try to do something conservative before we think about surgery. For instance, we might get you set up with physical therapy. We might do some anti-inflammatory type medications if you can take anti-inflammatory medicines. Sometimes we'll do injections either in the office or at the procedure center. If you ultimately decide to proceed with a hip replacement, we'll talk to either your medical doctor or we'll talk to your cardiologist if you have a cardiologist to make sure everything is ready for surgery. A hip or a knee replacement is a very reproducible procedure, so the most important thing is getting the patient ready for surgery. So for instance, if we have somebody that's a diabetic, we try to make sure their blood sugars are under good control before surgery. If somebody has heart issues, we make sure the cardiologist has their heart and blood pressure optimized for surgery. When we ultimately decide to proceed with a hip replacement, we will have you pick out the day that you want to have surgery done. You'll come to the pre-operative clinic usually about 2 weeks before surgery, and they'll draw some blood work on you, and they will probably get an EKG and have you meet the anesthesia doctor. There's several different types of anesthesia you can do for a hip or a knee replacement. You can do a general anesthetic where you're all the way to sleep, but sometimes the anesthesia doctor will recommend doing a spinal. A spinal is where they basically do a block for your back so that you can't feel your legs. During that time, however, they still give you medicine, so you basically think that you're asleep. So it's not like you're there talking to us during the procedure. When we do a hip replacement, what are we doing? We basically bring you into the OR. They'll do the anesthesia. We always give you an antibiotic to decrease the risk of infection. And then we position you on the table once you're asleep. And with a hip replacement, basically what's worn out is the ball and the socket are worn out. And so basically what we do, I've got a little model here to show you, is this shows you what a hip replacement looks like. So this is the pelvis right through here, and this is the femur. When somebody has arthritis of their hip, basically the ball and socket joint have basically worn out. And so what we do during the procedure is we make an incision and go in, and we remove the ball and we replace that with a artificial ball, and that is supported on a stem right through here. And then there's a socket that you can see right through there. And so basically what we're doing is just removing the ball and socket that's worn out and replacing it with a new ball and a socket in there. With the hip replacement, the surgery takes usually a little bit less than 2 hours. Then you go to recovery. Depending on how you feel and if you have any medical issues, things like that, preoperatively, will determine whether or not you go home the same day or go home the next day. We like to get you up walking the same day you have surgery. Most people initially will either use a walker or crutches just for balance protection. Most times we let you put full weight on the hip right away. After the surgery, you have a dressing on your hip, and we will put you on a blood thinner typically for about a month to decrease the risk of any sort of blood clot or anything like that after the surgery. The most important part of the whole process, though, is the therapy afterwards. So being motivated, getting ready for the therapy, following the advice of the therapist is very important. We always will give you some do's and don'ts after the surgery so you'll be comfortable with what the plan is when you go home. Sometimes we set therapy to come to your house. Sometimes we'll have you go to therapy near where you live, and that's kind of up to the patient and up to how easy it is for them to get around. Especially with hips, a lot of times we'll have therapy come to your house for at least the first 2 weeks. After the surgery and after you go home, you'll usually come back and see us about 2 weeks after the surgery. And at that point is when we can get your staples or stitches out. At that point, you can start getting it wet in the shower and kind of go from there. My name is Dr. Lloyd Johnson. I'm an orthopedic surgeon here at Alabama Bone and Joint. If you have any questions, please call us, come in and see me, and I'll be glad to take care of you. We have offices in Pelham, Clanton, and also in Centerville at Bibb County.